My name is Rafael Schmulevich. I'm a cardiologist. I've been with Trinity Health Systems for over 30 years already, practicing cardiology, which is a passion of mine. I went into cardiology after doing my internal medicine training in Wheeling, West Virginia, and then I did my fellowship in cardiology at Shadyside Hospital in Pittsburgh and finished in 1990. Since then, I've been part of the Trinity Health System. I'm currently the director of the cardiac cath lab and doing clinical and interventional cardiology. I think that cardiology for me it was a way to go straight to the heart of patients, to take care of one of the leading causes of death in the United States for men and women, and coronary artery disease and heart problems are one of those, and I wanted to be able to help patients with those conditions. Well, I always was interested in what we call heart catheterizations, the cath lab, and that allows me to take care of critically ill patients who come to the hospital in really big trouble with heart attacks. And nowadays, due to the new technology that we have available, we can take those patients straight to the cath lab when they present to the emergency room. When patients come to the emergency room with heart attacks, they have a blocked artery in the heart, and it's imperative that we act really fast to open that artery with what we call balloons or stents in order to decrease the chances of getting heart damage. So the sooner we open those arteries, the better the outcome for the patient. And that indeed represents that the sooner we open that artery, and we're very successful at doing so, we reduce the chances of the patient having potential problems with the heart, like heart failure, cardiac dysrhythmias, and even death. So it's like, in a way, we're right there trying to save a patient's life. In the old days, we didn't have this technology, and patients, when they had heart attacks, they were put in bed rest, they were given IV medications, but in those days we didn't have the tools to do the things that we can do nowadays. Well, as I said, when I was a fellow over 30 years ago, we were just beginning to do angioplasty, balloon angioplasties. In those days, it was a revolution, obviously, to be able to open those arteries that were blocked off with the plaque, with the balloons, to provide better blood supply to the heart. However, the balloon treatments had a problem at the beginning, that patients who come back to the hospital in the first 6 months with what we call restenosis. That's a process that the artery would build up blockage again at the side of the balloon. So after the balloon treatment, that was in the 1980s, we came up with the stents. The stents is a mesh of wire that it's mounted on the balloon, and when the balloon is inflated, it deploys and keeps the artery open, preventing a little bit the blockage to come back. But even in spite of those stents at the beginning, they were called bare metal stents, the blockage would come back not because of plaque, but because of a reaction of the body with the stent. So cells around the artery would grow inside the stent. That process is called restenosis. And now we have the newer stents that are called drug-eluting stents, which are stents with medications in them that prevent the growing of cells inside the stent and reduce the chances of the blockage coming back inside the stents. So that rate of restenosis in the old days was 30-40%. Now with the medicated stents, it's less than 5% that we see patients coming back with blockages. So that has really revolutionized cardiology because patients have a better outcome with all this new technology. It has many favorite parts, but I like to interact with patients families. I like to explain to them what their condition is. I like to get involved in trying to reduce the risk of the patients having more blockages. We know that the traditional risk factors for blockages in the arteries of the heart or coronary artery disease are high blood pressure, high blood sugar or diabetes, high cholesterol, smoking, and a family history. Obviously, we cannot do much today regarding the family history, but we can do a lot to reduce the risk of patients developing coronary artery disease or blockages in the arteries of the heart by quitting smoking, by having the blood pressure control, by having the blood sugar control, by lowering the cholesterol. Actually, if you do all those things, in general, you reduce the risk of having a heart attack or a stroke by almost 50%. It's like cutting your risk in half. So those are the main things that patients can do to reduce the risk of having heart issues. Well, I haven't been to other hospitals. I've been in Trinity almost exclusively all my career, but I think that we have a very good team of cardiologists. We have added new cardiologists to our team. We have added structural heart disease. We have an electrophysiology service. So that gives us a very nice variety of doctors that take care of different types of heart problems. And we have a very good cardiovascular team that reviews cases and decides as whether or not patients are better treated with surgery or with interventions. So overall, I think that compared to all the hospitals around the area, we have a solid cardiovascular team that really does a very good job taking care of heart conditions. I believe that the main thing in treating patients with heart issues is to really get educated, to ask your doctor if you have any symptoms of coronary artery disease like shortness of breath, chest pain, palpitations, fatigue, to discuss with your doctor, and your doctor will be able to decide if you need any testing to find out, to rule in or rule out the possibility of coronary artery disease, because by early detection, I think that you improve the prognosis and outcome of this condition that, as I said, is the leading cause of mortality for men and women in the U.S.